I want to talk about how cannabis may revolutionize Western medicine. Now, cannabis, it's unique medicine. Cannabis is so complex and so individualized. And I was thinking about this in one day and I was shaking my fist to the science gods like you do. Why is cannabis so complex? Why can't it be simpler like alcohol? And then I realized, no, even a simple molecule like alcohol is incredibly complex and we still don't fully understand it. So then I thought, well, rather than trying to squish cannabis into the narrow box of Western medicine, maybe cannabis can help us remember certain things about the body that we've perhaps forgotten. So maybe medical cannabis can help us remember that every body is different. Everyone's endocannabinoid system is different, but medicine is not one size fits all. Drugs have different effects on every body. Depends on your age and your sex and your genetics and your size and all these things. Now we know that everyone's endocannabinoid system is different, but we need to remember that not everyone responds to Valium or cocaine or alcohol or antidepressants the same way either. Now, cannabis is so complex, but maybe medical cannabis can help us remember that the body is complex and there really are no simple answers. We like to pretend there are. We like to pretend that depression is due to low serotonin. There's really no evidence that it is. We like to pretend that weight is about calories in equals calories out, when no, it is not. It's about hormones, it's about genetics, about many things. So some of the things we think are very simple, maybe because cannabis is so complex, we can remember that the body is complex, and that's a beautiful thing. Maybe medical cannabis can also help us to remember to honor the patient, not the pill. At first, I was very frustrated with cannabis medicine, which often says, try a little, see how you feel, see how it works for you. And for dosing, they say, start low, go slow. Then I was like, wait, what is this? 350 milligrams, that's medicine. But no, it isn't Western medicine, and that's okay, because all bodies are not the same. If you say, what works for you? Try it out and see how you feel. That allows the patient to consider what works for them. Not what is supposed to work on whatever an average body is, but how do they feel? Medical cannabis can also help us to remember to focus inward rather than outward. People using medical cannabis are encouraged to keep a journal about their feelings. We tend to be externally focused. So it's 12 o'clock, it's time to eat. Not, am I hungry, but it's 12 o'clock. And most of us prioritize externally oriented attention, which is largely controlled by the prefrontal cortex. So we eat in front of the TV and we don't even notice what we're eating. We just eat because it's time and we eat what's in front of us. But internally focused attention, that is controlled by parts of the brain called the insula and the posterior cingulate gyrus. That is more important in mood. So focusing inward, even for a few moments, can bring us back to ourselves. That's what meditation is. And meditation, which boosts activity in the posterior cingulate gyrus, is at least as effective, for instance, in treating depression as SSRIs are. So that inward focus can have a medical benefit all on its own. And since cannabis medicine encourages patients to focus inward, maybe that's one of the mechanisms by which it works. Now, medical cannabis can also help us to remember to critically evaluate information. There's so much false information out there just in general, but it's important to remember as you read about cannabis to evaluate the research that's done, because when they're talking about it, is it a full plant? Is it an isolate? Is it full spectrum? What's the dose? What's the route of administration? You'll see you have a very different effect if it's an edible than if it's smoked. And these things matter. So when you're reading the research, you have to stop and think and critically evaluate it and focus on good sources of information. And if we could do this, that would change everything. We are kind of in an anti-science time, but since people want cannabis, maybe this is the pathway that we can reach people to encourage inquiry and really thinking about the information. So in summary, Maybe medical cannabis can help us back to what medicine can be. It can help us to remember to critically evaluate the data. It can help us to remember that every patient is unique and we should honor their experience. And maybe cannabis can help us inject a note of awe and wonder at the complexity and beauty of the human body and encourage us all to rest, relax, eat, sleep, and protect.